Hi, welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In today's video I'm going to do a little bit of feedback on a conference that I presented at last week, which was the International Medical Students Congress of Bucharest, the IMSCB. So I was invited to this congress to talk to medical students. Usually there's a lot of medical training going on at this conference, and on this occasion they wanted me to talk about dissociation and my work in this field. And I thought this was a really interesting opportunity to go to Romania, which is a country that has undergone great trauma over the last 40 or 50 years. And what was really interesting about this is I was told that when my keynote presentation, which is called Hidden Dissociation in Clinical Context, was uploaded to the registration database, I was told that the entire presentation was fully subscribed within an hour, which was extremely hopeful. And so this is the message that I wanted to get across. A lot of people talk to me about very difficult experiences that they've had in medical contexts throughout their progression through health services, and their dissociation is often misunderstood or underlooked or ignored or completely not believed by a lot of doctors. And I suppose it's very easy to create a narrative that what this means is that sort of doctors are not really interested in trying to understand dissociation and have no real understanding of the nature of trauma, on the impact of the brain and on mental health. And the conference was a really nice example to show that this is simply not the case. That there were many students that came up to me before and after the presentation talking about their own experiences of wanting to understand and researching and reading more and looking online and watching programs about dissociation, and they had a real desire to try and learn more and more about this topic. The questions they were raising and the issues that they were looking at and the way that they wanted to try and understand this was extremely hopeful. And within the CTAD Clinic, one of the things that we're looking to do in 2024 is produce a training schedule for the year. So there's going to be face-to-face events here in the UK, and we're looking to do online training internationally. And what has come out of this conference really is the thought that, well, if there's this sort of desire for knowledge from doctors, and these were junior doctors at the start of their career, if there's such desire for knowledge from this group, let's try and open this out a little bit. And one of the things that I wanted to just raise today is that we are going to be promoting, we're going to be offering an online webinar specifically for doctors on understanding dissociation and being able to know what to do with it when they see it. So it's a very practical based approach towards dissociation that we're looking to try and put together. So for people that are watching this video, if you have a doctor that you have a good relationship with and that you think that they would like to know more and they're maybe sort of struggling to find sort of really good information or practical information that can help them in a 10-15 minute clinical session with a patient who is dissociative, to try and help them with that, please do keep an eye on our website. We're going to be releasing a training schedule for 2024 quite soon, and on there are going to be webinars for doctors. So I think it would be really useful if people would be able to keep an eye on that training schedule on the training part of our website, which will outline the dates for these things and pass that information on to medical health providers that you think might benefit from this. We all know that many people who are dissociative really struggle in medical settings. Mental health is often not particularly really well understood and dealt with in mental health services. In physical health services, it can be even worse. And we know that many people go through many different diagnoses before they arrive at a diagnosis of dissociation. And one of the things we're trying to do here at the CTAD Clinic is change the culture and build awareness and try and raise understanding and knowledge about this very complex and difficult condition that people have to live with. And it can be quite simple and quite practical in the approaches. So we're looking at offering short training webinars to medics to help them understand and just be aware so that they have some confidence, they know what to do, and they can help every patient that they see who might be dissociative through their journey throughout the healthcare system in whichever country they might be in. And this is something that the feedback from the training in Bucharest was excellent, and I'm sure that other people can benefit from this, and I'd be honoured to be able to try and provide this and use the CTAD Clinic as a platform for raising awareness amongst medics throughout the world as and when needed. So please do keep an eye on the training section of the website, and know that there are doctors out there that are extremely interested in this, that want to know more, that want to help. They're limited in their time because it's a complex mental health condition, and obviously these doctors have very, very short amounts of time in which to assess and understand the nature of people's difficulties, but there is a huge willingness for them to learn about this and do well. So as much as it's a practical message from us to doctors to be offering some training for them, it's also an extremely hopeful message that there are many, many people out there who are training in medicine who do want to know about this condition and do want to help people along their journey with it. So I just thought that was a really nice message to come away from the week with, to offer it to you, and it's a little bit different video. So hope you found this useful. Keep an eye on all our content and subscribe and share as much as you like. That's great. Keep leaving comments in the section below each video. We do read those, and we do take them into account. So thank you very much for those. And until the next video, please do take great care.